hospital aims to provide the state-of-the-art antenatal care and health services for mothers and medical care for infants and children. We're joined by one of the founders this morning, Professor Andre Venter. He's from the University of the Free State's Paediatrics and Child Health Department. Professor, good morning and thanks very much for your time. Firstly, the foundation has been already functioning for about a year. You're officially launching tomorrow. Just tell us what the past year has been like for you.
Well, it's been quite an exciting ride. We were very fortunate to obtain funding from the Karl and Emily Fuchs Foundation to establish this foundation, and the first year has really been getting the governance correct. So to get it registered, get the directors registered, so that we do everything legally correctly. We have had legal opinion, we've had a financial opinion, and that's really been what's been keeping us busy for the first year. But now we're ready to start with the business that we want to, and that's why we're having this major launch tomorrow here in Johannesburg.
So what's the business? What exactly will you be doing? Who's going to benefit from this when it comes to mother and child care?
Well, I think that's what's so exciting about the foundation. Initially, our idea was that we would only be working for children, but it became very clear that you cannot divorce mothers, infants and children. So we broadened our horizons, and we've got three main focus. The first focus is an ongoing focus we've always had in the Department of Paediatrics, and that's the upgrading of facilities for babies and mothers and children, and that's one of the legs. So that's we're continuously trying to improve their facilities. The second exciting project is we're going to be teaming up with the University of the Free State, who has started an initiative which they call Make the First 1,000 Days Count. And as you know, there's this whole thrust that between conception and 2 years of age is the critical time in a child's development, nutrition, and also the mother's state. And so that's going to be a focus. And under that banner, we're going to be aiming many different smaller projects. And then the large project, which is probably half the jewel in the crown, is with the Faculty of the Health Sciences and the University of the Free State, with the Department of Health of the province, is to establish a mother and child academic hospital in central South Africa, which at this stage is going to be in Bloemfontein, and if we're lucky enough, it'll be even on the campus of the university.
So at what stage, and you say that your aim is to help mothers and children from all walks of life, at what stage do you plan to sort of start that support? Because I'm asking because over the past couple of weeks, and we've seen it for years, but again coming up, the horrific stories of babies that aren't even born alive. The challenge of just giving birth to your child and sort of making sure that that child comes out alive and you get to take your baby home doesn't seem to be happening in many of our hospitals.
Yeah. Well, since there's a three-thrust interest, all three of those legs are moving forward, actually quite rapidly. So the one that would be interesting to you, about 1,000 days, that is still in the writing of the proposal levels at the moment. We have about 7 projects. They would cost about 20 million rand, more or less, but they are very different. There's from sterilization of mothers projects to nutrition, to immunization projects, to developmental projects. So there's a whole spectrum of them, and the first business in that is going to try and find funding for these various projects. They are not extremely expensive, but they are, if you put them all together, of course, it's quite a lot of money. And that's the community type projects, and we will start off in the university's outreach community first, but the idea is that later it should be rolled out to the whole of the province. So that's already going, that's that far. The upgrading of facilities is a continuous process. We've just upgraded the wards at Pelanomi Hospital, one of our hospitals. We've just repainted the wards in Universitas Hospital. So that's a project that goes on, and that is smaller funding. That is where people do lots of volunteering. So that's also going. And the third part of building the hospital, we're already at the point we've appointed a company to manage it and to build it. And what makes it exciting is going to be a whole new model, which has never been used before, and that's to have a privately owned, privately managed hospital, but it'll be a public facility and an academic facility.
Where will that be?
And that's going to be on the campus of the university, but it's in close approximation of medical school. I mean, obviously it has to be in the same area.
When can we expect this to happen?
Well, the company's just been appointed, so now, of course, there's a lot of hard work to happen. We have to get the license, then we have to get the funding. Because it's a private hospital, it'll be private funding, and then there's going to be very complex negotiations with government and with university about how we'll be funding the service for the children.
So this will be in that area. It will serve mothers and children in that area. What about the rest of the country? Plans to expand at some stage?
The rest of the country is difficult. I mean, as an academic hospital, tertiary medicine is our business, so we're actually looking at really complex conditions. And the hospital we're building is really for central South Africa. It's not a provincial hospital. So we already service Northern Cape at that level, sometimes a bit of the, I suppose I shouldn't say it, some of the western the provinces, a bit of the Eastern Cape, a little bit, and Lesotho, of course, and the Free State is our mother province, so that's where we have to do most of the work. So we already have a system where children are referred into the tertiary system, and that won't change. But the hospital that we are envisaging will have a strong community orientation. And so we're looking at non-profit organizations to try and make use of the facility to also then expand. And I am quite keen as a developmentalist and a neurologist to also get school children involved now already about parenting, nutrition, before they become parents. And I think that's another role we like to play for.
Prof, I'm sure you're not going to be short of volunteers who want to be part of this, but when it comes to the actual professionals, we know already, we've been hearing for years now about the shortage of OBGYNs, people, professionals who sort of are shy away from that part of things, which will be vital, I'm assuming, to this process going through. Nurses as well, the shortage of nurses that we have, professionals when it comes to public health care. How do you plan to tackle that, or are you sure that you're going to be able to fill those gaps?
Well, I think, if I can only speak for the Department of Paediatrics first, we are very, very fortunate that in the department, in the province, we are a well-stocked department as far as professionals are concerned. And what is going to happen is that entire department will move across to the hospital. So we are not going to be sitting without academic staff, professional staff, specialists. The plan is that the hospital will probably have to have its own nursing staff, so that's a problem we have to solve. Obstetrics and gynecology, I think this is a wonderful opportunity for them to establish a real state-of-the-art academic obstetric service for mothers, because as you know, in public service, and in private especially, this is dwindling. Less and less doctors want to do obstetrics. So I think it's a wonderful opportunity to really create a top-class obstetric unit there for mothers.
Well, I wish you all the luck and look forward to seeing how this all pans out. Thank you very much for your time.
Thank you so much.
He's from the University of the Free State's Pediatrics and Child Health Department.